I'm Diane Wedner, Lifescript.com. I was recently at the 2015 Clinton Health Matters initiative. I spoke with researcher Chloe Bird about heart health. Many women believe that they're at much higher risk for breast cancer than they are for heart disease. What's the reality about that?
Well, this is unfortunately a dangerous myth that we need to take on. We've had a lot of success in getting out the message around breast cancer. In fact, you have a 1 in 7, 1 in 8 chance of getting breast cancer in your lifetime. But in fact, you only have a 1 in 30 chance of dying of breast cancer. It's almost 1 in 2 of dying of cardiovascular disease for women. So it's much more important that we do a good job of prevention and that we do a good job of secondary prevention and that we invest in the science in order to better understand how do we treat cardiovascular disease.
At what age should women really start to focus on this and make it, if their doctor doesn't offer to give this information, at what age should they say to the doctor, can you just check out my cardiovascular system?
You start early on the prevention side, then a lot of little steps will get you a lot farther than a Hail Mary pass when you're 50 or 60 or later can ever accomplish.
What are the preventive measures women can take?
Well, certainly there's nutrition. Eating a diet that is lower in fats, lower specifically in saturated fats and those hydrogenated fats that get used in a lot of processed foods. Eating plenty of vegetables. Having sufficient calcium in your diet, and dietary calcium is preferable to having calcium supplements.
Should more women be taking statins?
Well, I think the first thing to realize is that statins are a big part of the reason that survival of cardiovascular disease is increased for men. Statins have the same benefits for women, but as with many other medications, women have more side effects. Many women have muscle pain with one or more of the statins. As a result, it often takes 2 or 3 statins to find one that's optimal, that a woman can tolerate very well. One of the other approaches that seems to work very well that I hear about from clinicians that I've discussed this with is very slowly titrating up the amount of statin that a woman's using in order to get her cholesterol under control.
Sounds like your overarching message to women is take care of your cardiovascular health. Don't be afraid to discuss it with your doctor. Eat right, exercise, all those usual good tips.
Absolutely, and ask your doctor to partner with you
Yes.
in taking on your cardiovascular health.